The prostate gland is a vital part of the male reproductive system, often overlooked or misunderstood until problems arise. Situated below the bladder and in front of the rectum, this walnut-sized gland plays a crucial role in reproductive health and urinary function. Anatomy and physiology of the prostate. The prostate gland is a compound tubuloalveolar exocrine gland that surrounds the urethra, the tube responsible for transporting urine and semen out of the body. Structurally, it consists of glandular tissue arranged in lobes or sections and is enveloped by a fibromuscular capsule. The glandular tissue is composed of epithelial cells responsible for producing prostatic fluid, while the smooth muscle tissue aids in ejaculation by propelling semen through the urethra during orgasm. Functions of the prostate. Production of prostatic fluid. The primary function of the prostate is to produce prostatic fluid, a milky substance that constitutes a significant portion of semen. This fluid contains various enzymes, proteins, and nutrients crucial for sperm survival and motility. Assistance in ejaculation. During ejaculation, the muscles of the prostate gland contract, mixing prostatic fluid with sperm from the testes and seminal vesicles to form semen. This mixture is then expelled through the urethra. Muscle control and urinary continence. The muscles surrounding the prostate assist in urinary control by helping to regulate the flow of urine through the urethra. Common prostate conditions. Benign prostatic hyperplasia, BPH. This condition involves the non-cancerous enlargement of the prostate gland, commonly affecting older men. As the prostate enlarges, it can squeeze the urethra, leading to urinary symptoms such as frequent urination, difficulty starting or stopping urination, weak urinary stream, or incomplete bladder emptying. Prostatitis. Prostatitis refers to the inflammation of the prostate gland and can be caused by bacterial infection or other non-infectious factors. Symptoms may include pain in the pelvic area, difficulty urinating, and sometimes flu-like symptoms. Prostate cancer. Prostate cancer is one of the most common cancers among men. It occurs when cells in the prostate gland grow uncontrollably. Early stages of prostate cancer may not cause symptoms, but as it progresses, symptoms such as difficulty urinating, blood in urine or semen, and bone pain may occur. Certainly, taking care of prostate health involves paying attention to diet. Several foods may have a potential impact on prostate health, either positively or negatively. Here are 8 foods that are often considered detrimental to prostate health. Red and processed meats. High consumption of red meat, beef, pork, lamb, and processed meats, sausages, bacon, has been associated with an increased risk of prostate cancer. These meats often contain high levels of saturated fats that might promote inflammation and contribute to cancer development. Dairy products. Some studies suggest that a high intake of dairy products, particularly high-fat dairy, could potentially increase the risk of prostate cancer. Calcium and certain proteins in dairy might influence hormone levels or promote cell growth, though more research is needed for definitive conclusions. Trans fats. Foods containing trans fats, such as commercially baked goods, fried foods, and margarine, are linked to inflammation and can negatively impact overall health, including prostate health. Trans fats increase bad cholesterol levels and are associated with various health issues. Refined carbohydrates and sugars. Diets high in refined carbohydrates, such as white bread, pastries, sugary drinks, and sweets, may contribute to insulin resistance and inflammation. Chronic inflammation is linked to an increased risk of prostate issues. Saturated fats. Foods high in saturated fats, including fatty cuts of meat, full-fat dairy products, and certain oils, palm oil, coconut oil, might contribute to prostate issues. These fats can promote inflammation and influence hormone levels in the body. Alcohol. Excessive alcohol consumption, particularly beer, has been associated with an increased risk of prostate cancer. Alcohol can affect hormone levels and act as an irritant to the prostate gland, potentially contributing to inflammation. Caffeine. While the relationship between caffeine and prostate health isn't entirely clear, some evidence suggests that excessive caffeine intake, primarily from coffee and energy drinks, might irritate the prostate and worsen urinary symptoms in individuals with prostate issues. High-sodium foods. Foods high in sodium, such as processed and packaged foods, fast food, and salty snacks, might negatively impact prostate health. High sodium intake is associated with increased blood pressure and might contribute to inflammation. Diagnosis and treatment. Digital rectal examination (DRE). A doctor may perform a DRE by inserting a gloved finger into the rectum to feel the size, shape, and texture of the prostate gland. Prostate-specific antigen (PSA) test. This blood test measures the level of PSA, a protein produced by the prostate gland. Elevated PSA levels may indicate prostate conditions, including cancer, but not always. Biopsy. If prostate cancer is suspected, a biopsy may be performed to collect tissue samples from the prostate for examination under a microscope. Treatment options. Treatment for prostate conditions varies based on the diagnosis. BPH may be managed with medications to relax prostate muscles or surgical procedures to reduce prostate size. Prostatitis treatment depends on its cause, which may involve antibiotics or other medications. Prostate cancer treatment options include surgery, radiation therapy, hormone therapy, chemotherapy, or a combination of these. It's important to note that while these foods may have some associations with prostate health issues, the evidence is not conclusive, and individual responses may vary. Moderation and balance in diet are key. A well-rounded, plant-based diet rich in fruits, vegetables, whole grains, healthy fats like those from nuts, seeds, and olive oil, and lean proteins can be beneficial for prostate health. Consulting with a healthcare professional or a registered dietitian for personalized advice is advisable.